Question 1. The U.S. Food and Drug Administration, FDA, heavily regulates items utilized in the Sterile Processing Department, SPD, to protect patient safety. Under which category does the FDA classify sterilization packaging materials such as wraps, pouches, and rigid containers? A. Class 1 medical devices. B. Class 2 medical devices. C. Class 3 medical devices. D. Class 4 medical devices. Correct answer B. Knowledge point explanation. Core rationale. The FDA classifies sterilization packaging systems as Class 2 medical devices because their failure poses a moderate risk to patients by compromising sterility. This classification requires manufacturers to adhere to special controls and submit pre-market notification for clearance. Trap analysis. Option A is incorrect because Class 1 devices are low-risk items subject only to general controls. Option C applies to high-risk, life-sustaining items like pacemakers. Option D is a fabricated category that does not exist within the FDA framework. Concept extension. All Class 2 packaging materials must be specifically validated for the sterilization modality they will be exposed to, ensuring the sterilant can penetrate while maintaining an effective barrier afterward. Question 2. While reorganizing older supply shelves, a technician discovers a stack of heavy canvas wrappers. According to current standards for sterilization packaging, why must the technician discard these canvas wrappers instead of utilizing them for surgical trays? A. Canvas causes the sterilization cycle to superheat instantly. B. The fabric weave is too loose to provide a reliable microbial barrier. C. The material is highly flammable inside a steam sterilizer. D. Canvas generates excessive lint that damages delicate instruments. Correct answer B. Knowledge point explanation. Core rationale. Canvas is completely unacceptable for use as a packaging material because its coarse, heavy weave is too loose. Although steam might penetrate it, the large gaps in the fabric fail to act as a barrier against microorganisms, leading to immediate contamination post-sterilization. Trap analysis. Option A is incorrect because superheating is typically caused by severely dehydrated textiles, not specifically by canvas material. Options C and D are false statements. Canvas is not uniquely flammable in steam, nor is linting its primary disqualifying factor compared to the barrier failure. Concept extension. Modern facilities utilize densely woven 140 thread count muslin or non-woven synthetic materials to guarantee an intricate, tortuous path that blocks bacterial ingress. Question 3. What is the primary function of a count sheet when it is included with a surgical instrument set prior to the sterilization process? A. To provide a highly detailed inventory list of the items contained within the tray. B. To outline the manufacturer's specific cleaning and sterilization instructions. C. To serve as an internal biological indicator for the sterilization process. D. To describe the physical dimensions and precise weight of each surgical instrument. Correct answer A. Knowledge point explanation. Core rationale. A count sheet functions as the exact recipe or manifest for a specific tray. Its primary purpose is to list what specific instruments belong in the set and the exact quantities required, ensuring accurate assembly and verification. Trap analysis. Option B describes the manufacturer's instructions for use, IFU, which is a separate critical document detailing how to process the item. Option C is incorrect as count sheets do not verify lethality. Option D is incorrect because count sheets list item names and quantities, not physical descriptions or weights. Concept extension. If a count sheet is placed directly inside the tray, the ink and paper must be validated as non-toxic and non-linting to prevent chemical contamination of the sterile surgical instruments. Question 4. A technician is loading a steam sterilizer carriage with multiple peel pouches containing lightweight scissors. To ensure adequate sterilant penetration and prevent trapped moisture, how must the technician position these pouches on the rack? A. Stacked horizontally flat on top of one another. B. Arranged with the plastic side facing the plastic side of the adjacent pouch. C. Placed on edge with the paper side facing the plastic side of the adjacent pouch. D. Arranged with the paper side facing the paper side of the adjacent pouch. Correct answer C. Knowledge point explanation. Core rationale. Peel pouches must always be placed on edge, vertically, and oriented so the paper side of one pouch faces the plastic side of the adjacent pouch. This creates uniform spacing that allows steam to penetrate the porous paper and condensate to drain effectively. Trap analysis. Option A is a severe error. Stacking pouches flat causes the plastic side to block steam from reaching the pouch below. Options B and D are incorrect because placing identical sides together, plastic to plastic or paper to paper, creates impenetrable thermal walls or traps excessive moisture. Concept extension. Technicians should utilize designated pouch racks to maintain this orientation and prevent the pouches from falling flat or shifting tightly against the metal sterilizer walls during the cycle. Question 5. A technician is processing a set of laparoscopic electrosurgical instruments for a scheduled procedure. To prevent severe internal patient burns caused by stray electrical current, how frequently must the technician test the integrity of the insulation on these devices? A. Once a week during routine quality assurance checks. B. Only when the surgeon reports a malfunction in the operating room. C. Every single time the instrument is cleaned and prepared for sterilization. D. After every 10 surgical procedures the instrument undergoes. Correct answer C. Knowledge point explanation. Core rationale. Insulation damage, such as microscopic pinholes, can occur during a single surgical use or the subsequent cleaning process. Therefore, strict safety protocols demand that the insulation of every electrosurgical instrument be tested for integrity every single time it is processed. Trap analysis. Options A, B, and D all offer grossly insufficient testing intervals. Waiting for weekly checks, surgical failures, or arbitrary procedural milestones forces patients to be exposed to deadly electrical risks from compromised instruments. Concept extension. Technicians utilize a specialized insulation tester, lap tester, to locate invisible defects. If an alarm sounds indicating a breach, the instrument must be immediately removed from service. Question 6. A sterile processing department, SPD, technician is preparing to package a delicate surgical camera utilizing a spun-bond polyolefin pouch. Which specific sterilization modality is this non-cellulosic packaging material explicitly designed for? A. High-temperature steam sterilization. B. Hydrogen peroxide gas plasma. C. Liquid chemical sterilization processes. D. Gravity displacement steam cycles. Correct answer B. Knowledge point explanation. Core rationale. Spun-bond polyolefin, commonly known by the brand name Tyvek, is a synthetic, non-cellulosic material exclusively engineered to be compatible with low-temperature sterilization methods, most notably hydrogen peroxide gas plasma or vaporized hydrogen peroxide. Trap analysis. Options A and D are incorrect because synthetic spun-bond polyolefin will melt when exposed to the extreme 250 to 270 degrees Fahrenheit temperatures of a steam sterilizer, destroying both the packaging and the instrument. Option C is incorrect as liquid sterilization is for immediate use and does not utilize permeable gas-based packaging pouches. Concept extension. Because hydrogen peroxide is heavily absorbed by cellulose, standard medical-grade paper pouches will cause the low-temperature sterilizer cycle to fail or abort automatically. Question 7. While assembling a major orthopedic set, a technician places several heavy-duty hemostats and bone rongeurs into the wire basket. To guarantee that the sterilant effectively reaches all surfaces, how must these hinged instruments be arranged? A. Lock the handles securely on the first ratchet to prevent movement. B. Arrange the instruments closely together with all sharp tips facing upward. C. Arrange the instruments in the exact chronological order the surgeon will utilize them. D. Unlock the handles completely and place them in an open position. Correct answer D. Knowledge point explanation. Core rationale. all hinged surgical instruments must be placed in the tray with their ratchets entirely unlocked and the jaws wide open. This critical positioning permits the steam or chemical sterilant to make direct contact with all hidden surfaces, particularly the dense box lock area and the serrated jaws. Trap analysis. Option A is a severe error. Locking the instrument creates metal-to-metal contact points that the sterilant cannot penetrate, resulting in unsterile instruments. Option B is a safety hazard, as sharp tips should be protected, not pointing up. Option C is related to operating room backtable setup, not a strict requirement for the sterilization process itself. Concept extension. Technicians often utilize specialized stringers or U-shaped holding racks to keep multiple hinged instruments uniformly open and neatly organized within the 25-pound maximum tray weight limit. Question 8. Following the decontamination and inspection phases, what is the absolute critical condition that all surgical instruments must meet before they are assembled into instrument sets and packaged for sterilization? A. They must be moderately wet to facilitate steam generation. B. They must be completely dry. C. They must be heavily coated with an antimicrobial lubricant. D. They must be fully assembled according to the manufacturer's blueprint. Correct answer B. Knowledge point explanation. Core rationale. Instruments must be bone dry before entering the assembly and packaging phase. Any residual moisture can severely interfere with sterilization cycles, especially low-temperature methods, promote microbial growth prior to sterilization, and directly cause wet packs at the end of a steam cycle. Trap analysis. Option A is false. Adding moisture disrupts the carefully calibrated parameters of the sterilizer chamber. Option C is incorrect. While specific water-soluble instrument milk is used in decontamination, items should never be heavily coated or dripping with any substance. Option D is incorrect because many complex instruments must remain disassembled inside the tray to allow sterilant penetration. Concept extension. A wet pack is considered contaminated immediately upon discovery because the moisture provides a wicking vehicle for airborne bacteria to travel through the sterile barrier. Question 9. A central service professional is attempting to protect the delicate tips of microscissors within a heavy stainless steel rigid sterilization container. Which of the following items is strictly prohibited from being utilized as an internal protection device because it acts as an impenetrable barrier? A. Validated vented tip protectors. B. A standard plastic peel pack. C. Approved medical grade foam pouches. D. Silicone organizing mats. Correct answer B. Knowledge point explanation. Core rationale. A peel pouch is a primary sterile barrier system in its own right. Placing a paper/plastic peel pouch inside another primary package, such as a rigid container or a wrapped tray, creates an excessive, unauthorized barrier that traps air and prevents the sterilant from reaching the delicate instrument inside the pouch. Trap analysis. Options A, C, and D are all expressly designed and validated by manufacturers for internal instrument protection and organization. They allow adequate steam circulation and condensate drainage when used correctly. Concept extension. This forbidden practice is incorrectly referred to by some staff as double pouching. True, validated double pouching involves nesting one slightly smaller peel pouch inside a larger peel pouch, ensuring paper aligns with paper and plastic aligns with plastic. Question 10. Which specific classification of chemical indicator, CI, is frequently referred to as a verification indicator or a cycle-specific indicator because it is meticulously engineered to react exclusively to all critical parameters of one precisely stated sterilization cycle? A. Type 3 CI. B. Type 4 CI. C. Type 5 CI. D. Type 6 CI. Correct answer D. Knowledge point explanation. Core rationale. Type 6 emulating indicators represent the highest classification of chemical monitoring. They are uniquely formulated to react to all critical variables, time, temperature, and sterilant concentration, for one specific, stated sterilization cycle, such as exactly 270 degrees Fahrenheit for 4 minutes of pre-vacuum exposure. Trap analysis. Option A reacts to only a single parameter, e.g., temperature alone. Option B reacts to 2 or more parameters but is not cycle-specific. Option C, integrating indicator, reacts to all critical parameters across a broad range of cycles and correlates with a biological indicator kill, but lacks the narrow, pinpoint specificity of type 6. Concept extension. Because a type 6 indicator is strictly tied to a specific cycle recipe, if a technician mistakenly places a 270 degrees Fahrenheit / 4 minute type 6 CI into a 275 degrees Fahrenheit / 3 minute load, the indicator will not provide accurate verification and will likely fail. Question 11. A scrub technician in the operating room accidentally brushes against the outer layer of a newly delivered instrument tray. Fortunately, the specific packaging method utilized by the Sterile Processing Department, SPD, provides a second chance at aseptic presentation, allowing the circulating nurse to remove the contaminated outer layer while leaving an intact inner layer. Which of the following packaging methods was utilized? A. Sterilization container. B. Simultaneous flat wrapper. C. Sequential flat wrapper. D. Approved containment device. Correct answer C. Knowledge point explanation. Core rationale. Sequential wrapping involves utilizing 2 completely separate sheets of wrapper applied one after the other. This creates a package within a package, providing an exceptional double barrier that allows the outer wrap to be removed by unsterile personnel while the inner wrap maintains the sterile field for the scrubbed staff. Trap analysis. Option B is incorrect because simultaneous wrapping applies 2 bonded sheets together as a single layer. If the outside is contaminated, the whole package is compromised. Option A provides a single rigid barrier. Option D is a generic term that does not specify a double wrapping technique. Concept extension. Regardless of the wrapping method, sequential or simultaneous, technicians must carefully inspect both layers for any pinholes, tears, or signs of wear before use to ensure the integrity of the microbial barrier. Question 12. An SPD educator is investigating a failed steam sterilization cycle where the chamber temperature spiked unexpectedly, resulting in dry steam that lacked the moisture required for effective microbial lethality. The educator determines that a specific densely packed item trapped air and caused this dangerous superheating effect. Which of the following items was most likely responsible for this failure? A. Pre-packaged sterile towels. B. Wet instruments with residual moisture. C. Surgical instruments with heavy bioburden. D. Electrosurgical instruments with thick insulation. Correct answer A. Knowledge point explanation. Core rationale. Dense textile packs, such as tightly bundled pre-packaged sterile towels or overly compressed linen, can effectively trap a pocket of air. This trapped air blocks steam penetration and becomes superheated, hotter than the surrounding steam but extremely dry, which significantly degrades the lethality of the sterilization process. Trap analysis. Option B causes wet packs, not superheating. Option C prevents sterilization due to soil acting as a physical shield, but it does not cause the ambient steam to superheat. Option D might require extended exposure times but does not cause superheating of the entire load. Concept extension. To prevent superheating, technicians must ensure that textile packs do not exceed the standard weight limit of 12 pounds and are placed on edge to facilitate adequate air removal and steam penetration. Question 13. When evaluating the performance of different rigid container systems, a CS technician observes that instrument sets housed within high-temperature plastic containers consistently require extended drying times compared to identical sets in anodized aluminum containers. What is the primary scientific reason for this processing discrepancy? A. Plastic naturally repels steam, completely preventing condensation from forming on the instruments. B. Plastic containers can physically accommodate a larger volume of instruments, leading to increased moisture retention. C. Plastic lacks the metal mass necessary to conduct and retain heat, which is essential for vaporizing moisture during the drying phase. D. Plastic containers are highly susceptible to microscopic cracking, which creates reservoirs for moisture to hide. Correct answer C. Knowledge point explanation. Core rationale: metal containers, such as those made of aluminum or stainless steel, possess a high thermal mass. They absorb and retain significant heat from the steam cycle, and this residual heat transfers via conduction to help evaporate condensation. Plastic is an insulator and lacks this metal mass, meaning it does not retain heat well, making the drying process much more difficult and time-consuming. Trap analysis: option A is false. Condensation will still form on the cool instruments inside. Option B is incorrect. The physical capacity varies by model, but the material's thermal property is the core issue. Option D describes a physical defect, cracking, not the inherent thermal property of the plastic material itself that universally delays drying. Concept extension: to combat wet packs in plastic containers, technicians must strictly adhere to the manufacturer's instructions for use, IFU, which may require the use of highly absorbent tray liners or specifically extended drying times programmed into the sterilizer. Question 14. A healthcare facility is systematically transitioning from utilizing traditional flat wrappers to heavy-duty rigid sterilization containers for all its major orthopedic loaner sets. While updating the department's standard operating procedures, the lead CS educator must document the operational disadvantages of these new systems. Which of the following represents a significant disadvantage of utilizing rigid containers? A. Additional cycle time may be required in the sterilizer to thoroughly dry the contents and prevent wet packs. B. They fail to provide a robust physical barrier against contamination during transport and storage. C. They do not provide adequate protection for delicate instruments from physical damage. D. They represent a single-use packaging system that generates excessive medical waste. Correct answer A. Knowledge point explanation. Core rationale: while rigid containers offer excellent protection and barrier properties, their significant mass and metal construction often cause excessive condensation to form as the hot steam contacts the cold metal. Consequently, they frequently require extended drying times compared to wrapped trays to ensure the contents are completely dry. Trap analysis: options B and C are the exact opposite of reality. Rigid containers are chosen specifically because they excel at providing robust physical protection and a strong barrier against contamination. Option D is incorrect because rigid containers are heavily regulated reusable devices, not single-use disposable items. Concept extension: if a rigid container is opened in the operating room and moisture is discovered inside, a wet pack, the entire set must be considered contaminated and rejected, highlighting the critical importance of adequate drying times. Question 15. Establishing a secure and validated seal is paramount when utilizing woven or non-woven flat wrappers. Which of the following items is the only approved device that can be utilized to close sterile packages? A. Standard metal staples. B. Painter's tape. C. Sterilization indicator tape. D. Industrial binder clips. Correct answer C. Knowledge point explanation. Core rationale: sterilization indicator tape is specifically engineered and scientifically validated to securely seal wrapped packages throughout the extreme conditions of a sterilization cycle. It also functions as an external chemical indicator, providing visual evidence of exposure. Trap analysis: option A is an absolute violation. Staples puncture the wrapper and instantly destroy the sterile barrier. Option B lacks the necessary adhesive properties for high heat and provides no chemical indication. Option D fails to create a continuous, secure seal and can crush or damage the wrapping material. Concept extension: technicians must be careful to use the correct type of indicator tape that corresponds to the specific sterilization method being used, e.g., steam tape versus ethylene oxide tape, as the chemical reactive ink differs for each modality.